So Dr. Olivia Domczewski, a doctor in clinical psychology at Barrington Behavioral Health and Wellness, is a graduate of Midwestern University in Downers Grove, Illinois. Dr. Domczewski has specialized in the field of clinical health psychology. Dr. Domczewski completed her postdoctoral fellowship at the University of Mississippi Medical Center's Department of Family Medicine, with a focus on primary care and health psychology. Throughout her training, she's worked with individuals and their families to help them cope with chronic medical conditions such as heart and kidney failure, hypertension and diabetes, cancer, as well as utilizing evidence-based practices for weight management, behavioral pain management, and sleep hygiene. Dr. Domczewski has a particular interest in organ transplant and advanced heart failure therapies, as well as grief and loss as it pertains to chronic illness and death and dying issues. Dr. Domczewski has worked in various settings, including community mental health, primary care, and general medical and psychiatric hospitals. She realizes that your healthcare does not stop when you leave the hospital or the doctor's office, and wants to help you become as successful as possible with managing your physical and mental health on a day-to-day basis. So again, with Oak Street Health, as you can see in the video, very much in line with a lot of the values that it sounds like Dr. Olivia is here to speak with us about. So super excited on behalf of Oak Street Health and Elderwerks to introduce Dr. Olivia Domczewski to speak about caregivers during our healthcare crisis.
Hi, everybody. I don't know if my PowerPoint is being shared.
Not yet. I will do that for you. Hold on one second.
Okay, thank you.
Didn't know I was doing it. I apologize.
No. I don't know. I thought I was sharing it.
Dr. Olivia, it's Carol Razzo. And while we're waiting on your screen sharing here with Jennifer, we'll have questions in the chat box.
All right, awesome. Thank you so much, everybody, for being here. It's always a pleasure to present with and for Elderwerks. So today I'm going to be talking about caregiver health during a crisis, and specifically during this crisis, but I think these things can apply during any type of crisis. And today I'll be talking about, and I've got some points on the next screen. So I will be talking about Caregiving 101, identifying stress and burnout. So on a basic level, what those look like. 10 signs of caregiver burnout, some coping skills, and I also have a caregiver bill of rights. And I think this PowerPoint will be shared with everyone, so you can have a copy of that Bill of Rights if you need to reference it, and also some resources at the end. Okay. So Caregiving 101. What is caregiving? Caregiving can take many forms. It can be helping family members, friends, and loved ones who are suffering from a chronic illness, such as dementia, cancer, anything like that. It can involve doing tasks such as grocery shopping, cleaning, driving to appointments, and doing everyday hygiene activities. Some of these things can be kind of difficult, especially right now during COVID. There's awesome resources like grocery delivery, through some of the major grocery stores, as well as, choosing your groceries online and picking them up. Driving to appointments. Some of these appointments can be done through telehealth right now, which is great, and something that I've been doing during COVID. So that's been kind of helpful to still keep connected to my patients. And I've heard a lot of other patients be able to do that as well with many different providers. Okay, so who are caregivers? Typically when we think of a caregiver, we think of a professional, but it can be anyone from a partner or spouse, an adult child, another family member, like a brother, sister, cousin. a friend. A caregiver is anyone who provides care to an individual. So, self-identity of caregivers. What does it mean to be, a caregiver? So we talked about some of the things that caregivers do, but sometimes when you have a relationship, with someone, if they are, your partner or spouse or, family member or friend, sometimes that relationship can get a little blurred. You might over-identify as a caregiver and that relationship can get lost a little bit. So it's important to keep in mind what relationship you had with that person, before you took over the role as a caregiver. And some people, might even have difficulty identifying as a caregiver, and that can lead to some issues as well. Who is, responsible for what? Sometimes a lot of resentment can build from that. So either over-identifying or under-identifying as a caregiver can lead to some issues. So what is stress and burnout? Just basic definitions of these things. So let's look over the definitions. So the definition of stress is the non-specific response of the body to any demand for change. Typically, when we think of stress, we think of distress, bad stress, and we know how harmful that could be, but we also have good stress and just enough stress that can motivate us to do things, to change. But typically when we think of stress, it's bad, but it's very common, especially nowadays. A lot of bad stress can lead to what we call burnout. And burnout is characterized by physical, emotional, and mental exhaustion caused by long-term involvement in emotionally demanding or stressful work. So caregiving is a very emotionally demanding or stressful work. It's demanding and stressful work. Some of the things that we can see in burnout, when we experience burnout, negative feelings like disillusionment and loss of meaning. So, you kind of go into a caregiving relationship sometimes and, you go into it, you want to help that person, do whatever they need, but sometimes the meaning behind that can get lost when we're burned out. We can also experience a reduced sense of accomplishment with burnout. So when we do something, we expect that, we kind of get something out of it. We feel good. And when we're burned out, we don't feel good anymore. We're just stressed out, resentful, and not to paint caregiving, as this terrible thing, because there's so many good things that we're doing. But I think going, through the motions day to day can really take a toll on us. And another characteristic of burnout is the development of skepticism and distrust. And this can be seen in, interactions with others, interactions with doctors and people just trying to help. You think that you're the only one that could be doing this job where you might need some help to step in, and it'll be great for you to have that help. And we'll talk more about getting those resources later. Burnout is also very common though, but I think it's important to go over the definition of burnout as well as stress, because prevention is a lot easier than doing something about stress and burnout when you're kind of really far into it. So that's why I wanted to really go over these definitions so we can identify them if that's what we're going through. So what are 10 signs of caregiver burnout? The first sign is denial. I think especially kind of in the early stages, we can kind of be in denial. For example, if we're caring for someone who's in early stages of dementia, they're still pretty lucid, they can do things on their own, but maybe they can't be, on their own. And so we think, oh, I know they will get better. And that might not be the case. It's really hard to accept these realities sometimes, but I think through education, looking up different articles and things like that about our loved ones' health status, asking questions of doctors can be really helpful. I think education is the number one thing that we can do to help us through this denial process and ultimately come to an acceptance of what is happening with our loved one. Another sign is anger. And I think that when you're feeling anger, it can be pretty valid. Sometimes the anger can be directed at your loved one, at the fact that, no cure exists, especially with, something like dementia. And anger at the fact that no one really seems to understand. You might not be surrounded by people who've been in the same situation as you have, or maybe they can't empathize, with your particular situation. There's a lot of complexities that go along with caregiving. And sometimes people, kind of forget how complicated it can be. So anger, any type of emotion, I think in these kinds of situations is valid. What's most important is what we do with that anger. And so again, we'll talk a little bit about that a little later. Another sign is social withdrawal. So this is kind of like not wanting to do what you used to enjoy doing. You start saying no to a lot of things. You don't really go out with, family members or friends. And, it's understandable that, as a caretaker, you're so wrapped up in what you need to do for your loved one, but it's also important to take that time away to kind of rest and recharge. But I think this is a common thing for caregivers to experience because they're just focused on getting through the day and they're sort of in survival mode. So they feel like they do have to put some things on the back burner, especially things that, seem fun and they would feel guilty about doing if they know that they have, their loved one at home that needs their care, even if someone else just as capable is there caring for them. Okay. Anxiety is another sign. So I think it's pretty normal to worry about, the future, what will happen when ... What will happen when, this gets worse? What will happen when, I have to think about putting mom or dad, in a community for, a higher level of care. So I think, all these questions, it's very common to have all these questions and worry about, what's going to happen. But again, I think a good thing to keep in mind is to learn to ask questions, learn to get resources, be in support groups. Those are very, very helpful things to help ease your anxiety and answer some of those questions that can be answered, to know your options. And so you'll have some time to decide on what is the best thing to do for your loved one. Depression is a very common sign of caregiver burnout. You feel hopeless, like things aren't going to get better. Difficulty with motivation, kind of getting up in the morning, doing things, doing the caregiving, can get really difficult. Loss of pleasure in things you once enjoyed. These are kind of key symptoms of depression that we see in caregivers. That statement, I don't care anymore, just kind of having this attitude of like, I just don't, I don't know what to do anymore. I don't care anymore. So it takes a while to set in, but it kind of catches off guard sometimes. So it's good to know about, what this looks like. Exhaustion. So this is kind of closely related to, I think these are all related to like anxiety and depression, but exhaustion is, a big one, because I think you know, after so many days of worrying and maybe not getting enough sleep, you know, we do come to this like physical and emotional exhaustion that just takes over, and it makes it really difficult to do the day-to-day tasks for your loved one and for yourself. You know, you still have to take care of yourself during this time. You know, um, sleeplessness is, I mentioned sleeplessness, you know, as part of exhaustion, but this is just the, you know, the physical act of getting sleep. Sometimes, you know, our thoughts are kind of racing through our minds at night. We can't turn those things off. And so, you know, when you're starting to have these sort of obvious symptoms, it might be time to reach out for some help. And I'll discuss a little bit about that later. Irritability is definitely very common. You know, you're easy to trigger. You might kind of have a short temper, snap at people. You find yourself kind of feeling moody. You might catch yourself, or you might not catch yourself. Maybe someone tells you, you know, why are you so easy to trigger? What's going on? Well, you know, caregiving is a very difficult thing, and I think if we're not doing the basic self-care, you know, making sure we get meals, sleeping, exercise, you know, it just kind of sets us up for failure. And over time, it just really wears away at us. And a lack of concentration, so difficulty remembering things or completing simple tasks. And this could be because of just having so much on your mind, you know, not getting that sleep. So it's important to, you know, again, get that self-care. You know, it can help to keep lists and keep reminders like in your phone or things like that. But ultimately, you know, those are just band-aids, and we really want to get to the root of the issue, which is true for, you know, all these signs of burnout. Again, it's really easy to go day to day, you know, not noticing these things, and then ultimately it kind of just, we realize what's happening. So it's important to kind of go over these things to know the signs so we can prevent it from getting worse. And health problems, you know, we're so focused on our loved ones' health, you know, but how about us? You know, this can take a huge physical and mental toll on us, and it's important for us to, you know, check in with our own doctors and just check in with ourselves too, especially with our mental health, and seeing if we're, you know, going through any of the signs of stress and burnout. Um, and, you know, making sure we get some kind of support, some intervention, so it doesn't get worse and have a worse effect, like you know, getting to the point where you might not even be able to do the caregiving tasks anymore. So any questions so far before we go on?
We haven't had any so far, so continue. Thank you, Dr. Olivia.
All right, thank you, Carol. So how can we cope? So I mentioned a little bit about, you know, some coping strategies, you know, peppered into what I was talking about, but just a quick list here, you know, taking care of yourself. You know, it's important to take time out. If it's enlisting another, you know, family member, or a friend or a professional, you know, caregiver, you must take some time out for yourself, get away, you know, from the situation, take some time to rest and reset your batteries, so to speak. It's also important to, you know, if you were exercising before, to continue doing that as much as you can. You know, that prevents, you know, some of that exhaustion, even though it kind of sounds like, well, if I like add another thing on top of, you know, what I'm already doing, I would be so tired. But, you know, I'm not talking about, you know, getting out there and running a marathon. Even just quick 5-10 minute walks outside can be very, very helpful. And you can even, you know, if the um, loved one that you're taking care of can still walk, you know, take them with you to get some movement. talking it over with someone who can understand. Maybe there's another family member who is kind of sharing those caregiving responsibilities with you, or even talking to a therapist or talking to a doctor about, how difficult it has been for you can really help to just say it out loud. I always tell people, when they come to therapy, just saying it out loud can be super helpful instead of, stuffing it in and not talking about it, kind of just pushing through, and not really acknowledging your feelings. But it's really important to do that, to talk it, to say it out loud, to process it with somebody, and get some kind of feedback. And you can feel free to tell people, I just would like for you to listen. You don't expect anyone to solve the problem, but also if that's something that you need, well, maybe they can help you with that.
I have a question, Dr. Olivia, for you.
Sure. Yeah, go ahead.
The question is, do you think that people sometimes are afraid to talk out loud about it, or afraid to talk to someone about how they're feeling and what's happening, feeling that they should be able to do it, or this is really what they're expected to do?
Absolutely. I think there definitely is a fear, and I have experienced, my patients coming to me and saying, I don't think I should be saying this, but this is how I feel. And, me, my job is not to judge. There's definitely a reason why you're feeling that way. And I would rather, talk it out, process it, get kind of to the bottom of it before something worse happens, before, the anger gets the best of you, your irritability gets the best of you, your depression, gets worse, and it becomes, to the point where you just can't do things anymore. You just don't want to get out of bed. You're having, thoughts of hurting yourself. I would, when I see someone in my therapy room, I want to hear that stuff because I think it's healthier to say it out loud. So of course you do have to kind of make sure that you trust the person that you're talking to. You can't tell just anybody about how you're feeling, but there are people that will hear you and that will validate how you're feeling, because there is a reason for it. So yes, I do acknowledge that there is a fear of talking about some of these things out loud.
Thank you.
You're welcome. If there's any follow-up question with that, I'll be glad to answer it. I think I left out at take time to have fun. So I know that it's kind of hard to have fun. You kind of feel guilty if you leave your loved one in the care of someone else, but this is your time, to have that reset moment, to kind of charge your batteries, as well as, trying something new, being creative. You can even try doing something new or creative, with your loved one that you're caretaking. That could be a fun activity if they're able to kind of participate in it. But if not, don't be afraid to try something new, on your own. Seeing the funny side, this kind of goes along with the previous two that I mentioned. Maybe you can kind of joke around with, your loved one that you're caretaking. Try to have like a lighthearted view of the situation. But I know that there are some serious moments that definitely has to be taken into account. But again, kind of having this balance of funny, lighthearted, having some laughs. They say laughter is medicine. I think it can cut through kind of the seriousness sometimes, which can be very helpful. And journaling, if you are scared of talking to somebody about how you're feeling, I think journaling is a really great way to, again, just have an outlet for the feelings that you're having. You know, depending on how safe you feel writing things down. I know sometimes, you know, people are scared that if they write something down on paper, someone may find it. So you can still write it on paper and then destroy it just to kind of get it out there. But I've known people to have like password protected files on their laptop or computer or even on their phone, just to have, you know, someplace to let it out. Having an attitude of gratitude can be very helpful. You know, even in the toughest situations, we can kind of look at, you know, what we're thankful for, where we can be thankful for the fact that we are capable of caring for our loved one, and that our loved one, you know, is still here with us. Um, so kind of changing your perspective on the situation can really help, and just looking for little things, you know, to be grateful for. Trying to empathize with your loved one, kind of seeing where they're coming from. So I think when we, you know, can read about, you know, our loved one's condition and sort of understand what they might be going through, it can be a little bit easier to see maybe why, you know, sometimes they have really difficult days or need the type of care that they do need. And this is a big one, stress management. There's like an umbrella called stress management, and so many things can fall under this. But I think it ultimately comes down to, you know, doing the things that I talked about here above. But you know, when we think about just our basic needs, getting, you know, consistent meals throughout the day, drinking enough water, getting enough sleep. Even, you know, even if you can't get enough sleep at night, maybe taking some time out throughout the day, taking a nap if you have the time. And again, you might have to enlist some help in order to do some of these things, but it is totally worth it. So you're able to kind of keep caretaking. I always tell my clients, you can't pour from an empty cup. So you have to fill your cup first before you can fill the cups of others. And I think that's really the goal of stress management, is to fill your cup first so you can continue doing what you've been doing, which is a very, very challenging thing, but also it can be very rewarding. So again, recognizing the signs of stress and burnout can help you know where you're at, and to start being proactive about how you can approach, you know, your stress, how you can approach burnout, because it's easier to prevent certain things than kind of get it when it's already really set in. It is okay to ask for and accept help. I know it is easier said than done for so many reasons, but it is okay to ask for and accept help. And I think the more that you do this, the easier it will become. And one thing to remember is that you cannot be a perfect caregiver. As much as you try, you cannot. There will be some mistakes. There, you know, you will have days when you feel like you didn't do the things you knew you were supposed to do, but no one is perfect. And so again, easier said than done, but I think having that kind of in the back of your mind, telling yourself, you know, you did the best you can with what you have, I think is a really important thing to remember. So when we talk about diagnosis and treatment as a way of kind of coping, I think this kind of goes along with like the education. So we want to make sure that, you know, our loved one gets the proper diagnosis, so they're getting the proper treatment. So keeping in close communication with your loved one's healthcare providers, asking questions, you know, maybe doing some research on your own, attending, you know, these types of talks, Zoom calls, workshops, whatever you'd like to call them, you know, getting as much information as possible can help you be, you know, a more informed caregiver, and to be an advocate for your loved one, because at a certain point, you know, they're going to need someone on their side to advocate for them. And also, you need to be your own self-advocate as well. So, letting people know kind of what you need in order for your loved one to get, the help that they need. I think a good way to prevent stress and burnout is learning how to relate to your loved one. Being reasonable and logical may not work. What is, when our loved one is saying something and it just doesn't make sense to us. I think this is especially important with our loved ones with dementia. Their brain, just on a biological level, it's just not working the same as ours. And so we might have to learn kind of how to work with them versus against them. So join their world. It might be helpful to just change the subject if you find that they're kind of ruminating on something, especially something that's pretty distressing. So changing the subject to something that might be more pleasant, that calms them down, can be very helpful. Breaking down activities into small steps, so they don't get overwhelmed, can be very helpful. Some of our loved ones just don't have the capacity to remember, all these steps that they might have been able to, remember in the past, but, now it's just not possible. So, if you're talking about the plan for the day, you can say, well, first we're going to go to the grocery store, and then kind of stop there. And then after the grocery store, you can say, okay, now we're going to a doctor's appointment, so don't give them too much of an itinerary for the day, just kind of take it step by step. So white lies are okay. I think that being honest can cause some distress to people. So, a good example is, if someone loses their spouse, and they don't remember that their spouse had previously passed away, it can be okay to say, oh, they're going to be back soon, don't worry, and then, change the subject. Making agreements or asking someone not to do something will not work. It may be forgotten. So if you find that your loved one is, for example, either, engaging in some like annoying behavior, or doing something, that's, maybe not appropriate, simply asking them not to do something will not work. Again, their memory capacity might not be there, even though, some of these things might be very distressing. There are, certain ways to kind of cope and deal with that behavior that is beyond my training, but I do know, and I do have some resources if people are interested in kind of how to deal with certain behaviors, and so I can provide that as well. I have my email at the end of this presentation, so feel free to jot that down. Recognize if you are over or underestimating what someone can do. So when we think of, our loved ones and the skills that they've lost, sometimes it's easy to forget that they can't do certain things. And also, if we kind of have this idea of like, okay, I'm caretaking my loved one, they need my help, but they might not need your help with everything. And so it might be helpful to let them just do it, maybe with your supervision, but it can help them with a sort of like self-confidence, so they still feel capable in doing certain things, because they still, are aware, if they are, at the stage where they still are aware that they can do certain things. Tell, don't ask. So instead of asking, would you like to go to the grocery store today? You can tell them, we will be going to the grocery store today, just to kind of give them more guidance, more structure in the day. And I think this is a hard one, when our loved one is having a good day, and they're more lucid than they, usually are, it's okay to question the diagnosis and say like, was that diagnosis of dementia really the right diagnosis? Like they're talking to me like they normally talk to me, like this is the same, loving mom or dad, that I used to talk to. But this is normal in certain diagnoses where people do get moments of lucidity where it seems like nothing is wrong, but the diagnosis still may be true. How to improve your communication. So some of these can be hard, especially when you're stressed and burnt out, but try interacting with a positive mood. I think a lot of people, especially with dementia, they can read you very well. They might not know who you are, but they know kind of how you make them feel if they see you. And it's important to always have, to approach them with a positive mood. When you're talking to someone and you feel like they're, kind of looking around, not really, they're distracted, you can get the person's attention. You can ask them to, maybe look at you, keep saying their name, or, maybe gently tapping on their shoulder when you're talking to them to have their gaze look at you. But it's important to, not do any like sudden touches or anything like that, because that can agitate somebody. Stating your message clearly and simply. So instead of using, long sentences, maybe simplify your sentences and really get to the point of what you're trying to say. And when it gets tough, feel free to change the subject. If it's distressing or they're just not getting it and that's distressing to them, it's okay to change the subject. Provide a lot of reassurance. Individuals with dementia, they can kind of get lost a little bit. They, trying to reassure them and trying to gently reorient them can help. But just saying, I'm here, it's okay, we're okay, can be very helpful. You might learn a lot from your loved ones, so listen to their stories. It might be very helpful for them to kind of go back, in their long-term memory and talk about, maybe when they were kids or, younger, and listen to kind of what things they've gone through in their life. And it's important to laugh. Like I said, laughter is considered to be medicine. So having those moments to take time out and laugh, maybe watch a funny show or a movie, or talking about, a funny story, can be very helpful to lighten the mood. So I mentioned troubling behavior a little bit before. So some things to remember, and so this is kind of like a general list, but if you need some more information, I have that handout, as I said. Remember, we cannot change the person. There's always some reason for a behavior, and it can be pretty obvious what that reason is. Sometimes it's not that obvious, but I think, educating yourself and maybe seeing if there's like a pattern in the behavior can be very helpful. So remember, behavior has a purpose, can be triggered by certain things, but it's not on purpose. I'm sure that there's certain things that kind of make us question, like, why are they doing that? But it's not on purpose. I'm sure if they, knew kind of what they were doing, if they were still kind of in a rational state of mind, they probably would not be doing that. What works today may not work tomorrow. We might, have something down that day, and it's like, okay, this is what's going to work to help, my loved one. But tomorrow you might find that it just does not work anymore. So, and that's okay. Sometimes these things are not consistent, but there are certain things that can be helpful, and it's important to kind of build like a toolbox of sorts, you can say, of things that you can kind of go to and try and see what works on different days and what doesn't. And if you need some help, with ideas, you can check with their doctor, and see maybe what is behind, some of the behaviors that they're engaging in. They might have some more insight into, why they're doing certain things, and get support. I think it's important to talk with individuals who are going through similar experiences. There are support groups, you can talk with a therapist who is very well versed in, working with people with dementia, for example, or Huntington's or MS or anything like that. So it's important to reach out and get support. It doesn't have to be, I kind of thinking about that fear that people have. It's, for us as professionals, it's not our job to judge. I always try and keep an open mind to maybe why people are feeling a certain way, and there's always a reason. So kind of getting to the bottom of it and seeing what's going on, and helping that person understand what's going on can be very helpful. So just to wrap up, some quick tips. It's okay to accept help. The more you do it, the easier it'll become. Focus on what you're able to provide. I think being honest with really how far you can extend yourself, what caregiving tasks you are able to do, and maybe what tasks another person might be willing to do. Setting realistic goals, so for yourself and for your loved one. I think there's definitely some things that make our goals challenging, but I think it's important to kind of step back and say, like, okay, is it realistic for me to want my loved one to do these certain things on their own? Again, taking into account what they can and can't do. Getting connected with resources, like I said, there are support groups. There are, mental health professionals that can be very helpful. There is a difference between like support groups that are, not led by a professional, and support groups that are led by a professional. So it's important to kind of maybe get a feel for both and see which one you would maybe like better. Seeking social support. So, talking to friends, loved ones, again, maybe having that like trust but verify attitude, being careful with what you say, but it is important to, maybe it's good to talk with maybe a friend who has also been a caregiver for a loved one. Also important to set personal health goals, making sure you still get to the doctor maybe once a year, going to the dentist, every 6 months, getting lab work, making sure you're taking your medications every day, talking to a therapist, whatever those goals look like, please do them and see your doctor. So the Caregiver Bill of Rights. I don't know if I have enough time to read really quick.
We're about
5 minutes.
5 minutes. Mhm.
Okay. All right. I'll read this through because I know it's kind of little, so I'm not sure if everyone can see. But I have the right to take care of myself. This is not an act of selfishness. It will give me the capability of taking better care of my loved one. I have the right to seek help from others, even though my loved ones may object. I recognize the limits of my own endurance and strength. I have the right to maintain facets of my own life that do not include the person I care for, just as I would if he or she were healthy. I know that I do everything that I reasonably can for this person, and I have the right to do some things just for myself. I have the right to get angry, be depressed, and express other difficult feelings occasionally. I have the right to reject any attempts by my loved one, either conscious or unconscious, to manipulate me through guilt and/or depression. I have the right to receive consideration, affection, forgiveness, and acceptance for what I do from my loved ones for as long as I offer these qualities in return. I have the right to take pride in what I am accomplishing and to applaud the courage it has sometimes taken to meet the needs of my loved one. I have the right to protect my individuality and my right to make a life for myself that will sustain me in the time when my loved one no longer needs my full-time help. I have the right to expect and demand that as new strides are made in finding resources to aid physically and mentally impaired persons in our country, similar strides will be made towards aiding and supporting caregivers.
Dr. Olivia, thank you
All
very
right.
much.
Yes.
What a wonderful presentation and extremely good resources. Please, we have Dr. Olivia's contact information in the chat box, and she has it here as well.